Good morning and welcome to our COVID-19 press briefing. Today is Tuesday, October 5th, 2021. This is Kathy Turner, Director of Communications for the Department of Public Health and Wellness. Dr. Sarah Moyer, Director of the Department of Public Health and Wellness, will be hosting the briefing today. Joining her is Dr. SarahBeth Hartlage, Associate Medical Director for the Department of Public Health and Wellness. Dr. Monique Williams, Director of the Louisville Metro Office for Safe and Healthy Neighborhoods, as well as Vincent James, the city's former Chief of Community Building, who continues to serve as a member of the Office of Safe and Healthy Neighborhoods Advisory Committee. I'd like to remind everyone to please mute your devices, place your questions in the chat addressed to everyone. Thanks, and we'll get started in just a few seconds.
All right, good morning, everyone. I'm Dr. Sarah Moyer. The mayor had a schedule conflict this morning, so I am hosting today's COVID briefing. Thank you for joining us. Today, Dr. Hartlage is going to share our COVID data and key updates on COVID, but I'm also looking forward to a discussion about how the COVID pandemic and gun violence are connected. Pre-COVID, we saw a decade-long decline in life expectancy across the U.S. and in Louisville. Much of this rise in premature death is due to rise in despair, rise in hopelessness, inequity, and easily availability of lethal means. Previous press briefings have connected COVID to the rise in overdose deaths and death by suicide. Today, I wanted to spend time diving into how it's also connected to our homicide and gun violence crisis. I've invited Dr. Monique Williams, Director of Louisville's Metro's Office of Safe and Healthy Neighborhoods, to join us for that discussion, as well as Vincent James, the former Chief of Community Building. Vincent continues to serve as a member of the Advisory Committee to the Office for Safe and Healthy Neighborhoods. But first, let's take a look at our COVID data with Dr. Hartlage.
Thanks, Dr. Moyer. Let me pull up the dashboard here. All right, so unsurprisingly, we are still in the red category. We have an incidence rate reported of 68.4 cases per 100,000 of population. Reminder that the red zone begins at 25, so still, double the necessary rate. It will take us some time to climb out of that red zone, even as cases have started to maybe decline a little bit. We had 3,670 new cases last week and sadly reported 30 additional deaths. If we look at the graph here, you can see that so we're sort of bouncing around a little bit, going up and down, seesawing and in the last couple weeks. And this may represent a plateau. We hope it represents kind of a slow downward trend. So hopefully we'll see those numbers continue to slowly go down. The death rates, again, are kind of seesawing in parallel to the number of cases, which is what we would expect. When we look at our vaccine data, you'll see a new bright green line here, the dots on the right. So that bright green line represents doses that are a third dose or a booster. So obviously those just recently became available, so that number tracks back to 0 a few weeks ago. And it's gone up dramatically really in the last 2 weeks. Of note, this includes both the technical third dose, which is the dose for immunocompromised individuals, and it also includes the booster doses that are for those 65 and up and those with medical conditions, high-risk occupations, high-risk residences like long-term care facilities. The rate of administration for primary doses, which is the orange line, and the secondary dose in the blue line, those have slowed down a little bit, or at least leveled off from the kind of bump that we saw associated with the Delta variant. we have 56% of our population that's completed their vaccine series, which is 430,000 folks. And the percentage of people who have had at least one dose is 64.1%. So almost 500,000 people have had at least one dose. If we look at this data in terms of those who are 16 and up, who are widely available to receive vaccination eligible, that number is actually above 70%. So we see folks getting vaccinated, and our young people, teenagers being vaccinated as well. We're hoping to see the approval for Pfizer for kids 5 to 11 in the coming weeks and be able to see an increase there as well. Let's see, hospitalization numbers have trended down a little bit with the cases, and ICU admissions and ventilators also are down a little bit, but they are down from the peak that we saw record highs a few weeks ago. So the numbers are still high, and our healthcare workers are still under a tremendous amount of strain. Remember that we know from previous experience that the hospital admissions peak slightly after the cases, and that deaths peak slightly after that. So we do expect those numbers to continue to stay high for at least several weeks to come. And remember that about 90% of hospital and ICU admissions are still in unvaccinated people. So while vaccinated people may get an infection, it's typically mild, and they don't typically require hospitalization or invasive significant care. In terms of demographics, we continue to see the majority of our cases in the white population. That's roughly proportional to their racial makeup of the metro population. The most interesting thing is to look at the breakdown by age, where we see that very low case counts in the 65 and up population. As we zoom into recent weeks here, when we break it out by age, the 65 and up population has very low case counts, likely because the vaccination density in that group is very high. Vaccines are less prevalent in the younger folks who may feel like they don't need it, or that it's not something that they want to do. The 20 to 44 group are young adults in the blue group here can continue to have the highest incidence of new cases. So that vaccination rates in that group are relatively low, and that definitely bears out in the way that the cases are presented. That's all we're going to cover for today. So thanks, Dr. Moyer, and I'll hand it back to you.
Thanks, Dr. Hartlage. I know there's been a lot of concern with fall break and what we should be doing because of that. What trends are you seeing, and what are you recommending to people right now?
Right, so JCPS did have fall break last week, so lots of kids out of school for at least a few days. I hope that everyone was able to get a little time to rejuvenate. For those who did travel, we do recommend that you get tested just to be safe 3 days before you travel and 3 days after. Especially if you're traveling outside the state, or if you're going to be getting on an airplane. You can still check our website or call the helpline, and they can direct you to many places where you can find available testing appointments.
Thank you. Fall's also a great time for lots of family fun events, like going to the pumpkin patch or trick-or-treating. How can we enjoy these things safely?
That's a great question. I know we love the fall. There's lots of fun things to do. And the great thing is that we're getting a little bit of the break in the weather. So it's a little bit cooler, and we are able to have fun outside. So outside events like the hayride or going to the pumpkin patch are generally pretty safe because you can be outside and distanced from people. You don't have to worry so much about ventilation. So we do continue to recommend avoiding large groups or indoor gatherings, including Halloween parties. I know last year with our Halloween, we had a epicenter of cases that was related to a high school age Halloween party, and we're hoping not to see that again this year. We do recommend that you wear a face covering, and remember that your Halloween mask doesn't count. So your surgical mask or cloth covering that you've been wearing, hopefully you can continue to do that. And finally, remember that the vaccines for our young children, they are coming and they are coming soon, but they're not here yet. So make sure that you include a mask in your little one's trick-or-treating plans. And I know my 6-year-old has a sparkly mask that she'll be wearing with her Elsa dress. She's very excited to accessorize. So everybody remember to put your mask on with your Halloween costume this year.
That's awesome. I can't wait to see pictures. Well, thanks, Dr. Hartlage. Please stay with us, as I'm sure we'll have lots of media questions about COVID at the end. So moving on to our next topic, when we look at gun violence through a public health lens, we like to treat it like a contagious disease, and gun violence, especially among our youth right now, is spreading quickly. We know gun violence isn't random. Both guns and violence spread like infectious diseases through social networks in the real world and online. COVID has increased anxiety, depression, and isolation. And we know people who are depressed are more likely to commit violence against themselves in the case of suicide and overdose, or against other people in the case of homicide. Unfortunately, the discussion about violence is often framed as a moral failing, and people engaging in it are seen as being beyond redemption. However, this ignores the underlying factors and causes that lead to gun violence in the first place. It kind of reminds me how we failed to tackle the drug epidemic in our poor Black neighborhoods in the 80s and 90s, and now how it's spread to all of our neighborhoods in the 2010s and is still the leading cause of preventable death here in Louisville. But as we learned with COVID this year, when we come together as a community and invest resources, we can tackle anything. So I'm going to kick off the conversation today with some data. Catalina, can you bring up the first slide? So in these next 3 slides, you can see that the pattern of overdose, suicide, and homicide are similar. They tend to rise and fall together. And that's because the root causes of all 3 are very similar. As of October 1st in 2021 in Jefferson County, according to the coroner's data, we have had 165 homicides, 147 suicides, and 381 overdose deaths. This compares to 140 homicides, 148 suicides, and 366 overdose deaths in all of 2019. If we go on to the second slide, note that the homicide or the overdose rate in 2021 is inaccurate, as it takes a few months for the tox screens to come back in the coroner data. So we do expect those numbers to rise and be closer to our 2020 numbers as we get to the end of the year. Going on to the last slide, the most striking statistic is how gun violence is hitting our youth. In 2019, we lost 17 youth to homicide, and then in this year, as of October 1st, we've lost 31. That's 31 young people age 18 and younger due to homicide. And compare that to 0 deaths so far for COVID under the age of 18. So joining me now is Dr. Monique Williams, Director of our Office of Safe and Healthy Neighborhoods, and Chief Vincent James, Chief of Community Building, who oversees the agency's tackling root causes of health inequities like parks, resiliency and community service, and ocean. So to get started, Chief James, can you give a little background on why the Office of Safe and Healthy Neighborhoods when it was started and why it was started?
Thank you, Dr. Moyer, and glad to be here this morning and definitely talking about, a issue and a crisis in our community that I'm very passionate about. And in particular, when we think about the creation of the Office for Safe and Healthy Neighborhoods, it was started in 2013 and actually started as the community came together after a triple homicide in 2012. During that, in May 17th of 2012, and after the triple homicide, the mayor had called a group of citizens together to identify what can we do together. And so in pulling on the social muscles of the community and working with law enforcement, working with elected officials, we were able to develop a comprehensive plan. And part of that plan was recommending the Office for Safe and Healthy Neighborhoods, that a dedicated office of the mayor would be focused on violence prevention, looking at homicides, suicides, and drug overdoses. And so that was the creation of the office in 2013. And Anthony Smith was director at that point, and now we have a new director, Dr. Monique Williams.
Thanks. And can you explain a little bit how the mission has changed, and maybe Dr. Williams kind of tell us a little bit about what you're focused on and what you're doing right now with your office?
So, well, I'll say from what I know about the original mission of the office, I don't think much has changed as far as what the office was created to do, right? It was birthed in the public health department. And so the original mandate really was to take this public health approach to violence prevention and improve the outcomes as it related to violence in some of our high priority areas within the community. And I don't think much of that has changed over time, right? And so one of the key public health principles within that, like epidemiology, which is focusing on health effects, characteristics, root causes, and influences in a well-defined population. And so I think that remains the same. But for me, I think what's being elevated is just really trying to hone in on ensuring that what we are doing is truly grounded in the public health approach, ensuring that what we're doing is comprehensive and also grounded in the evidence base, but it's also socially just. And as Chief James talked about in the beginning, you know, at first we were looking at homicides, suicides, and overdose. And now we're more so just kind of focusing on homicides and trying to utilize the resources that we have to at least tackle one main issue.
Thank you. So let's talk about the intersection of the pandemic and the increase in gun violence. Dr. Williams, what connections are we seeing in the data and research between the pandemic and violence?
So a few things. I mean, if we look back at 2020, we were hit really hard with gun violence and the pandemic as well. But the pandemic really intensified the impact of our gun violence crisis, and not just as a city, but as a nation. And we're seeing similar trends across the nation, right? And so as a nation, we saw, I believe it was a 25% increase in non-suicide related gun deaths, so gun homicides from 2019 to 2020. And I mean, that's a significant increase as a nation. As a city, from 2019 to 2020, we saw an increase at almost 4 times that rate, which is extremely significant for a lot of reasons, because that's a huge increase. There were several reports, you know, in the last couple of years of increases in mass shootings in the last year due to the stresses and pressures associated with COVID-19. We had unintentional shooting deaths by children increased by nearly 1/3 compared to, I think this study compared incidents between March and December of 2020 in comparison to 2019. And so that 1/3 increase. And so the pandemic saw like millions of children out of school while our gun sales hit record highs, bringing more guns into the home, which then resulted in a lot of the tragedies that we saw in the surging of the number of children accessing firearms and unintentionally shooting themselves or someone else. And again, seeing that same trend here locally when we talk to, you know, our own local children's hospital at Norton's, and they saw an increase in unintentional shootings during the pandemic. And so getting back to the fact that lots of people were buying guns, you know, ammo stores were empty. And there was a study done, I believe, by Everytown, and they used the number of background checks. And they estimated that people purchased about 22 million guns in 2020. And that was a 64% increase from 2019. And so again, we have these record increases in gun sales. We've had the increased isolation or the increased social isolation, all of the things that we know are contributing to the pandemic, as you mentioned, Dr. Moyer, are also risk factors for violence. and then the economic struggles due to COVID-19 that put many people at risk for gun violence. And so that just takes us to, the conversation around social determinants of health and the fact that people don't just generally wake up every day and decide that they're going to shoot somebody. There are many factors and a lot of factors that are outside of the control of an individual that play into how violence is happening in our communities in the first place. And so we see a lot of correlations between when the pandemic started, the things that the pandemic interrupted, which also then impacted how we're experiencing violence in our community.
I think those are all excellent points about how one pandemic is exacerbating other ones. I like to say that COVID didn't start anything new, but it's definitely worsening some of the inequities and outcomes that we have in our community. Moving on to the next question. What are some of the overlaps we're seeing between communities hit hardest by the virus and the surge in violence? I know you mentioned some. Is there anything else you want to add?
Well, so the communities hit hardest by the virus are the same communities hit hardest by the surge in gun violence. And so in these communities, you'll find lower vaccination rates for a myriad of reasons, right? And so you have some people who are more focused on physical safety from gun violence than they are on getting or paying attention to a vaccine. You have a population of individuals who are extremely hard to reach already when we talk about those who are most impacted specifically by gun violence, which is our young Black male population. And then you're talking about engaging this population in habits that are healthy, that are going to keep them alive. And so there are strategies when we think about contact tracers are using that same type of strategy with community violence interventionists who could then not only help individuals deal with their safety issues, but also encourage vaccination and other healthy behaviors with that built relationship. And so really utilizing the strategies that we know work in public health and that we've been utilizing for the pandemic also for our violence issues. But then also too, you have some people who are just skeptical in these communities about engaging with health systems and certain health practices due solely to, the medical apartheid against Black communities that has been historic in the US. And so the pandemic has really aggravated the very factors that are driving a lot of the violence in the city. A lot of our Black and brown communities have borne the heaviest burden of gun violence in most cities around the country. And we've had generations of systemic, racial discrimination and inequities in healthcare, housing, education, employment, and many other factors which have exacerbated the risk of gun violence. And so this has made certain communities more susceptible to the devastations of COVID-19. And we know that, from the latest statistics that I've seen, that Black people are around 2 times as likely to die from COVID, than white people. And we also know that, Black people are 10 times as likely to die from gun homicide. And so we have this disproportionate impact of both the virus and the gun homicides on marginalized communities, which just continues to illustrate, the country's systemic issues and highlights the need for actual structural change, as well as some sustained financial investment in some of our historically marginalized communities.
So I know we've been mentioning that we like to take the public health approach to violence, and you've been doing that for years now, but I still think there's some confusion out there in the public of what that really means. What does taking the public health approach to violence look like for you?
So for me, I think foundationally, people don't even completely understand all of public health. I think the pandemic has brought to the forefront a lot of what public health is and a lot of what public health does. And so, for us, public health is promoting and protecting the health of people and the communities where they live, learn, work, and play. an easy kind of understanding of what it is that we do as public health practitioners, where if you think about a doctor, you go to the doctor when you're sick, and doctors treat people who are sick. But as public health practitioners, you try to prevent people from getting sick or injured in the first place. And so our strategies promote wellness and encourage healthy behaviors. And so when you talk about addressing violence with a public health lens, we're talking about ensuring that our strategies promote wellness and engage and deal with those that are most at risk for whatever the thing is, and getting informed that with a strategy that has been proven to work, essentially. And so then we use the public health model, or the public health approach to violence prevention, which is essentially our approach to most things, right? Defining the problem is key, and then identifying what the risk and protective factors are, developing and testing prevention strategies, and then assuring the widespread adoption of those strategies when we know that they work. And so violence as a public health issue isn't new. We've been doing research for decades. There's over 20 years, almost 30 years at this point, of research related to violence as a public health issue and how we need to be addressing this issue. I think the hardest thing is probably the paradigm shift that has to happen to help people understand that it's not just about the perpetrator and or the victim and the decisions that have been made at that individual level, but because of what we understand with public health and the fact that there are, again, I'm going to talk about these social and structural determinants of health that even impact an individual's decision-making processes, we have to be more holistic in our approaches. And so it looks like building out those comprehensive, holistic approaches that we know work in and with communities to ensure that we're getting the long-term outcomes that we're wanting to see. And I mentioned earlier, one of the more well-known kind of strategies that we utilize in public health was actually birthed from an epidemiologist. And the strategy, again, as I just talked about, utilizes something that looks like contact tracing, individuals who get in front of the transmission of violence. And the goal is to isolate that infected person, treat and rehab that individual to keep violence from spreading to the next person. But we know that strategy is only a part of the puzzle, and it's on the side of where we're already dealing with something. And so we're trying to get in front of it. And so as much as we're focusing on intervention at this point, and we need it, we also have to be heavy on our prevention side. We also have to be heavy in the what is going to solve this issue long term. And what is going to solve this issue long term is addressing our social and structural determinants of health and building out our strategy, or our vaccine, if you'd like to call it, for violence prevention that hits all of the other notes that people see less connected directly to the outcome of violence. Yeah, and I mean, again, this is something that we know is preventable, something that we know that we can do something about. And right now, getting back to that between COVID and violence, you know, our hospital systems are already overwhelmed with COVID. And as we increase shooting victims, you know, we're increasing opportunities for COVID spreading, and there's limited hospital resources that need to focus on COVID and other chronic illnesses. We can do something about violence. We just have to shift our paradigm and put the resources in the places where they need to be to address the issue.
That's great. I mean, it's just kind of like how we tackle COVID, right? Contact tracing is one piece of it, trying to stop that spread from going to others, but testing and identify the people that are at risk and making sure communities have all the resources that they need to do what we're saying is really important. Real quick, I know Chief James, you got to hop off here at 10:30. I don't know, hopefully you have time for one last question. I know that we keep hearing that we need a community response as well. What are you hearing from partners that we could be doing more and better?
That's a great question, Dr. Moyer. I think one of the things when we talk about a community response, it's really approaching it from a multi-sector approach as we're looking at violence prevention. That's one of the reasons, we identify with a public health approach, because it does require a multi-sector approach, that we're talking with the business community, we're talking with education, and an example of that is the mental health providers in school systems, in terms of particularly JCPS, and working with JCPS is really critical, even as we're thinking in a more focused way, addressing youth violence, because most of the youth that we're seeing in the community are students at Jefferson County Public School System. So it's a critical partnership that we've been forging over the years, to be able to identify, to begin to work with, to also support one another's initiatives, because it's critical as we think about the community coming together, as well as the faith community engaging in a way that allows opportunity for the community itself to begin to address the issues of violence. And so faith communities are stepping up, being able to provide safe havens, opportunities for the community when a incident occurs, that you have a safe place to go and receive counseling, receive resources. And so these are the opportunities when we talk about a community response, that it really takes all of us and putting forth an effort and doing what we do best.
Thank you. And I know if you got to hop off, please do so. Dr. Williams, anything else to add to that? And as we move to wrapping up too, what can residents do if they want to find out more? Where can they find out more information about the work that you're doing?
Sure. So they can, reach out to the office. There's our website. There are social media platforms. Reach out and get engaged. And I mean, not just get engaged in the work that we're doing, as we're trying to, educate and help people understand what violence is, how it happens, why it happens in the communities in the ways that it does. Learn how to be an ambassador, learn how to mobilize in your community, and also learn how to mobilize in partnership with other communities to address this issue. The best thing people can do is share information when they get it. Be a part of the resolution and not just somebody who is complaining about the problem. We're going to list a tip sheet here in the next week that kind of delineates what individuals can do, whether you're in the business community, whether you're just a concerned citizen, what educators can do, what faith leaders can do, what mental health providers can do, to give people some ideas about how they can get engaged in this work.
Well, thank you. Really appreciate the conversation discussion today. Thank you for joining us, and please stay if you can for a few minutes. I'm sure there's going to be plenty of questions. So just in closing, it's really good to see that we're taking our lessons learned from COVID and the substance use disorder crisis to really dive in and tackle our violence crisis as well, and making sure people have what they need to thrive, especially our teenagers, whether that's good jobs, housing, education, food, and healthcare. And addressing our underlying issues such as mental health, substance use, trauma, and hopelessness. So just appreciate you guys joining me today. And I am going to turn it back over to Kathy to go through any questions that might come up.
Okay, thank you. It's kind of quiet in the chat this morning. There is one question from WLKY to Dr. Williams. There's a vaccine for COVID. What would the vaccine be for this uptick in youth violence?
So, I mean, right now, we're dealing with the fact that for a lot of, we're dealing with children, first of all. And so mentally, the impact of COVID-19 is hard on some adults. The impact of children, I'm not going to speak to from a research perspective because nobody's researched it yet, other than being able to ask young people how they're coping with this. And coping mechanisms are and have been much different for children in this. And so addressing mental health traumas right now of young people, but also too, when we think about protective factors against violence, which are things like schools themselves and other institutions and spaces where young people can be a part of pro-social engagement, things that are developing their personal identities, their social identities, they're engaging in activities that are positive. All of those things were kind of shut down for a minute And so we took away a lot of the protective factors, and now some things are opening back up, but we're opening back up after being closed for so long. And so lots of things have happened in those spaces. And so I think one of the big things is to address the issues of mental health happening with our young people to the degree that we can, and then do the things that we already know that young people need, particularly when you're talking about young people who have been placed at higher risk for engaging in or being perpetrators themselves of violence. Peer support, positive relationships, opportunity and access, whether that is, educational, employment, depending on the things that young people need. But it's almost like right now they just kind of need to be wrapped around in a way that they were isolated from for a very long time. And then being intentional about what we know in the research when we're talking about particular kinds of violence, whether it's gang violence or just, an issue between one young person and another young person that ends up in a conflict, deploying the strategies that we know work for those kinds of things.
Okay, thank you, Dr. Williams. Dr. Moyer, I don't see any other questions in the chat. Just wanted to give the reporters one more chance. Does anybody have a question? Any other questions about how the pandemic and violence are related, or anyone have questions regarding COVID and our latest data? Okay, we're going once, going twice. Oh, WLKY is going to put one more question in. Maybe that will give others time to think of another question.
Kathy, while they type, I think I'll just add for their previous question, what would the vaccine be? I mean, I think that's part of the frustration in public health is we don't have that like one big protection for violence. Like it takes that whole approach that you guys saw that we had to do in the beginning of COVID before there was a vaccine, with the distancing and making sure people have all those protective factors, whether it's housing, food, being able to follow our recommendations. And so there is no, unless you count like armor, bullet vest or something. I mean, I don't know if there isn't that one thing. And so it's a lot of work to do what we're doing. And it makes the frustration of how we have people that aren't vaccinated yet more so, because there are other crises going on in our community that we also need to be focusing on.
Okay, thanks. I'm still waiting for one more question from WLKY. Okay, here we go. How difficult has it been to reach these children with so many resources closed, starting with schools closed? Would these numbers have been lower if there had not been a pandemic?
I definitely say that, we wouldn't have probably seen the spike that we've seen. We may have had similar trajectories because at the end of the day, we already had a crisis that wasn't completely being adequately addressed. But the degree to which we're seeing, in all of the overlap, but like we have a Delta variant now. And essentially we have a Delta variant in how violence is happening in our city right now that is more so impacting our young population. And so we have an opportunity here to pivot and almost get in front of this before it becomes as exacerbated as our normal violence crisis has already been. But I don't believe that we would see what we're seeing now had it not been for the pandemic.
Dr. Moyer, anything to add?
No, I'd agree with that. And just looking at the data, we know that numbers this fall have been less than last fall when school was not in session. So there's a lot that plays into that. So I think school is one piece, and unfortunately our school systems have picked up a lot of the gaps that are in our community. And so providing the food and support and kind of guidance for our young people. So not just the school, but it's just the function of how school's been asked to pick up what's been missing in the rest of our community.
Okay, well, there are no more questions in the chat. So we'll thank everyone for joining us today, and we will see you next week.